Hello, everyone. Good evening. I'm State Senator Brad Hoylman here. I'm here to have a conversation with a COVID-19 survivor, one of the earlier survivors in the pandemic, whose story, I think, captivated, I'd argue, the nation because of the harrowing experience that he had and the way he shared it on social media leading up to it and soon thereafter, as well as the fact that he is not the typical victim of coronavirus. I think that we were told about early on, whether you're very old or immunocompromised or have some sort of pre-existing condition that might make you vulnerable. I'm talking about David Lat, who's here with us today. Welcome, David.
Oh, thank you, Senator.
It's really good to have you. It's really good to see you. You look really well, and I'm really pleased to see that that you're recovering even still. David, you're 44. You had run marathons. You have a family. You're very active professionally. I think most people knew you before this as the founder of Above the Law. I know as a lawyer and having so many friends in the profession, you're certainly well known in that regard too. Actually, tell us a little bit about Above the Law and the founding of that blog and how that began, and then we'll lead into your story.
Yeah, sure. So I, as you mentioned, am a lawyer by training. I practiced law for about 7 years, including 3 years at a law firm in New York, Wachtell Lipton. And then I was working as a federal prosecutor in Newark, New Jersey, under then U.S. Attorney Chris Christie. And I started blogging at a different blog called Underneath Their Robes, which was sort of a fun judicial gossip blog that I did under a pseudonym. Eventually, I revealed myself. Shortly thereafter, started Above the Law. This was in the summer of 2006. It's a legal blog that covers the profession, law firms, law schools, the judiciary, and it's been around since then, and it's really grown in terms of the number of contributors, in terms of the audience. It gets more than 1 million unique visitors a month. It's one of the largest legal news websites in the country.
And before you were stricken with COVID-19, you had moved on to a different phase of your profession, right?
Yes, that's right. Last year, I left Above the Law, at least as a full-time editor, and joined Lateral Link, which is a legal recruiting firm. So we help legal employers find talent. I still do write a column for Above the Law every 2 weeks, but I'm not really as in the trenches as I used to be.
So before you were hit with coronavirus, like what was your day? What was your week like? Were you like the rest of us? Nervous as hell, taking extraordinary precautions. I know you have a young child and a husband. What was your mindset before you got the virus?
So I have to admit, I was not really that worried because it seemed like an abstraction. It seemed like something that was happening far away. Oh, it's happening in Asia or it's in Washington State. And in late February, early March, I was certainly following the news like everyone else, but I didn't really think it was necessarily coming here. Of course, I followed, this was early March, so there was at the time, there was no shelter-in-place order, there was no mask wearing requirement, but I tried to take cautions. I washed my hands a lot. I would press the elevator button with my elbow. I tried to be careful, but we were not yet where we are now in terms of public health measures.
Were you going to work?
Yes, I was. In fact, I went to work on one Monday when, to be honest, I should not have been at work. I probably was contagious at that point, but I did go into the office one Monday, which I think must have been like Monday the 9th or so of March. But at that time, there were very few confirmed cases. There were under 50 confirmed cases in New York City. So it really didn't seem, it's a city of 8.5 million people. What are the chances that I'm in that narrow sliver?
Yeah. Do you know when you and Zach, your husband, may have contracted it? I mean, were you at a party? Was there any was there any exposure that you can trace your illness to?
No, it really was so-called community spread. I started to feel a little sick the weekend of March 7 or 8, but it was really just fatigue. We went out to dinner with some friends and I felt really out of sorts afterwards. And so they were going to grab some after dinner drinks and I said, "Oh, I'm just going to go home." But it was just fatigue at that point. And I didn't get fever and chills and aches until later, which is why I went to the office on that Monday, because I just kind of thought, oh, over the weekend I was a little tired, but I feel fine now. I'll go into work.
And what was the day that you thought, turned to your husband, I guess, and said, I may have COVID-19? Was there that realization?
Yeah. So Monday, Tuesday, Wednesday of that week, I started a fever, chills, and Thursday, the fever went away in the morning. So I thought, oh, I'm out of the woods. But I was wrong. Thursday afternoon, Thursday afternoon, I started to get a really bad cough and was getting a little bit short of breath. And that's when I kind of thought, this is not just a regular flu.
So how high was your fever at that point?
It varied. It was usually in the 101, 102 range, but it got as high as 103.9 or so. So that is, as we now know, fairly typical for COVID-19 to have a pretty high fever.
It was
103.9, 104. Wow. That was as high as it got.
Was that with Tylenol?
No, that would be before. And then I would take fever medications to bring it down.
So close to 104?
Yeah, pretty high.
I mean, that's high for a 2-year-old, as I'm sure you would.
No, it was very worrisome.
And that's what took you to the emergency room, or was it an issue?
It was really the shortness of breath, actually. It was the Sunday, I think maybe March 15 or so, where I was really having a hard time breathing. And at that point I said, you know what, I'm going to go to the ER.
Yeah. And when you got there, were you, which ER? Was that NYU Langone?
Yes, which I believe is in your district, right?
Yes, it is. Credit to them.
Yes.
And
yes, go ahead, sorry.
And they immediately took you in?
Not on the first visit. On the first visit, my symptoms, I guess, were not yet at the level where they were going to admit me, but they got worse. And when I came back Monday, they admitted me and pretty much immediately had to give me supplemental oxygen.
And was your husband with you, or was he with your son?
No, Zach stayed because it wouldn't have made sense. As we later found out, when you're a COVID-19 patient, you can't have any visitors, which is one of the hard things about being hospitalized with it. You're isolated, or even if you have it at home, you're supposed to be quarantined from your family members who are not sick. So he stayed at home.
So this is like a scene out of Contagion, where our doctors wearing full masks and suits, or what was the protocol?
Yeah, they put me in an isolation room, which has so-called negative pressure, meaning that it is a different pressure from the outside area, so that none of the air, the basically contaminated air, goes out from my room to any other part of the hospital. And there was a garbage bag right outside of my room, and anytime anyone wanted to come in or out, they would put on all of this PPE, personal protective equipment, and they would talk to me or treat me or whatever they had to do. And then when they would leave, they would remove it and throw it all away. And of course, they washed their hands when they came in, and they washed their hands when they came out.
And so maybe you benefited, I mean, I could be wrong, by being one of the earlier patients there. It probably wasn't maximum capacity at Langone.
No, I was one of the first 1,000 cases in New York State, and one of the first 500 cases. These are confirmed cases because, as the antibody tests may suggest, there's so much we don't know about this disease. Yeah. It seems that maybe more people had it than they realized. But just in terms of confirmed cases, or people who were tested positive, I was one of the early cases. So there were resources. There was never any shortage of personal protective equipment. I was placed on a ventilator later, and there was no problem with that. So in some ways, I did benefit.
Yeah. Well, I was wondering about your thought process. Did they come in one day and say, we're putting you on a ventilator, or did it happen without your even knowledge at that stage?
No, It did. I was awake for it, but it went by so quickly. I was admitted on a Monday. I was stable for a couple of days, and then Friday night going into Saturday, sometime after midnight, uh, someone, I believe a nurse, came in, and maybe it was a doctor, I can't remember now, and basically said, your oxygen levels have fallen, you're not doing well, we're gonna put you on a ventilator. And of course, they asked me, do you consent to this? But of course, if in their medical judgment I should be on a ventilator, I said yes. And they asked me a whole series of other questions that were kind of scary, like, do you wish to be resuscitated if necessary? Do you want to be an organ donor? Who has your health proxy? Questions like that.
And were you familiar? I mean, again, it was so early in the pandemic, relatively speaking, that like I wouldn't have thought probably that most folks who go on a ventilator have a good shot of not surviving. Was that something you were aware of?
Yes. Now, I didn't know the exact statistics, but my dad, who's a doctor, had told me a few days earlier, oh, you better not wind up on a ventilator. Not everyone survives that. And so I was like, thanks, Dad. When I heard that I was being put on a ventilator, it was pretty scary because of what he had told me.
Wow. So we're here, viewers, with David Lat, COVID-19 survivor, legal analyst, founder of the blog Above the Law, and a real live case of a COVID-19 survivor who shared his story on social media. What made you want to start tweeting about your experience in the hospital? And when you started tweeting, you had no idea the ventilator was in order for you.
No, the reason I went on social media initially, Facebook and Twitter, was because I wanted to alert people who had had contact with me that I might have unwittingly given them coronavirus. So I wasn't really in a very good state. I was, on oxygen. I didn't really have the ability to go through my appointment book and look at the past 2 weeks and make a list of my contacts. So I wanted to try and do it as efficiently as possible. So I went on Facebook and I went on Twitter and I said, FYI, I have a confirmed case of coronavirus, COVID-19. If you've interacted with me in the past 2 weeks and get symptoms, you should get yourself tested. That was really my original motive. But then I got such a positive response in terms of people being supportive, saying, hang in there, I hope you feel better, that I thought, you know what, this is a relatively new disease. People don't know that much about it. Why don't I chronicle my journey in real time? So that's what I tried to do.
I guess that's the journalist in you coming out.
Yeah.
And, but you were, I guess, also one of the original contact tracers, self contact tracers. What are your thoughts about had we managed to have a governmental role in contact tracing early on? Do you think it would have made a big difference?
Oh, absolutely. I think if it had been just a few weeks earlier, certainly I would have been a lot more cautious myself, and I wouldn't have gone to work when I started to feel ill. And there were other things that I didn't realize at the time were symptoms. So for example, on that Sunday when I first started to feel a little tired, but didn't think I had anything big, Zach and I went out to dinner to a favorite restaurant of ours, and the food had no taste. And we didn't realize at the time that that's a pretty distinctive symptom of COVID-19. So we just thought, oh, the kitchen's having an off night. But if I had had that and there was more public awareness and I had been told to be careful, I would have self-quarantined immediately instead of going into the office the next day.
And part of probably what made you a little blasé about your early symptoms is the fact that Zach continued to have few or none, right?
Well, he did get sick a little bit after I did. He started to have symptoms too, but they weren't as bad as mine. For him, it was really like a week of bad flu symptoms. So it does show that this disease hits people differently. This virus hits people differently. Some people are totally asymptomatic and other people end up dying from it. There's a wide range.
And when you were in the hospital ready for the intubation, you sent your last tweet, I guess, before you went under. And then the next thing you remembered is that you were being awakened, 6 days later. Is that really what it amounts to?
Yeah, I was actually really fortunate. I don't really remember anything from the intubation experience because a lot of people who do remember have not very good memories. There's a kind of almost like a PTSD from people who are in the intensive care unit. So for me, I was in critical condition on a ventilator in the intensive care unit for 6 days, but I remember very, very little of it. And I don't have flashbacks or hallucinations or nightmares like some of the other people who've been through that. So I'm grateful I don't remember anything. It was just like 6 days carved out of my life. It was like a Rip Van Winkle thing. I couldn't, it was almost like those days hadn't happened. I found out, for example, I found out much, much later that while I was under, Terrence McNally had died. And I thought, wow, Terrence McNally died. That's terrible. But it was like, it had happened like a week earlier, but I wasn't awake that week. So everything that happened in that week was like a big nothing to me until I kind of belatedly found out.
Yeah. So you had to catch up on
Yeah.
reality. And in the meantime, your husband and your parents and your in-laws, and I don't know about your son, how were they relating with your illness? Were they calling? Was the hospital responsive? What kind of information could they get?
So it was a really terrible time for them. And in fact, to the extent that I was just out, they had a worse time than I did because they were just agonizing for 6 days about what was going to happen to me. And they felt like it was really a coin flip as to whether I was going to live or die. And they would call the hospital and the hospital would call them. Generally, it was about once a day. Sometimes it took a little while to find the right person or to get the call returned because the hospital was really very, very busy. But in general, the hospital did keep them updated and did keep them apprised of my condition.
And do you have any sense of like what the triage like terms were for you? Like who was going to be making those decisions since they weren't there and you were intubated?
So Zach was my medical proxy. I gave him the right to make decisions on my behalf. So, for example, while I was on the ventilator unconscious, I was given an experimental medication that required consent, and he gave it on my behalf. And I think it helped, actually. Hard to tell, but it's a medication that is designed to fight this so-called cytokine storm when essentially your body sort of turns on itself, instead of fighting the virus, it's fighting itself. So I was given this drug called clazakizumab, which is supposed to quell that response of the immune system. And it does seem to have helped while I was on the ventilator.
There is a commonality, right? Where it's the body's immune response often suggests how you're going to do with this condition. If it's an overly active one for whatever reason, it doesn't necessarily bode well for you, right?
Yes, exactly. It's the opposite. You'd think, oh, isn't that good? But no, it's not.
Yeah. And so on day 6, you wake up and does the light shine into the room and there are birds chirping outside of your window, or is it just you're in a fog?
I was in a fog, actually. They give you a lot of medications, a lot of drugs, sedation to keep you under. And I don't really remember the moment when I was extubated or brought off the ventilator. And it even took me a little while to get back on Twitter. It took me a day or two before I said, oh, by the way, I'm off the ventilator. I'm doing well. Thank you for all of your thoughts and prayers and support. I would have wanted to do that immediately if I had the clarity and the presence of mind, but I didn't. I was in a haze for the first 24, 48 hours.
Now, is it true that at least a couple of newspapers were preparing your obituary? That is a grim and frightening.
Yeah, I know I can laugh about it now, but one friend of mine, was a lawyer in DC, said he had been contacted by a reporter who was working on a draft of my obituary. So I tweeted that. And then a reporter from a different paper said, oh, no, we didn't assign a reporter. We just talked about it in our staff meeting about doing one. So there were actually 2 papers that that had the idea of doing it. One was farther along than the other. So, but I can't blame them in the sense that, look, I was in critical condition in the ICU for a week. And, a lot of obituaries are actually, at least in part, pre-written, which explains how whenever some prominent person passes away, there's this beautifully written obituary that appears, within hours, and a lot of them are sort of in the can.
Yeah, I do think though that an individual for which an obituary is pre-written should have access to that obituary.
Huh?
They can
That'd
see
be interesting.
what they need to live up to and beyond. Uh,
Yeah, exactly.
yeah,
They can
but that
quibble with it. Yeah.
fascinating. I think you should try to most certainly get a copy of it if that's possible. So, you know, you had none of the apparently issues that kind of come with intubation, and there was no organ failure or,
No.
uh, you know, we've read stories of individuals who have really had a difficult time. Things that you would not associate with intubation, like you know organ shutting down and blood circulation
Yep.
supply. But you persisted in that regard. What about the post extubation effects? I know when you were appearing on television, radio, your voice was hoarse. It seems to have come back pretty strongly.
Yeah, no, the voice is a lot better now. But that was one of the side effects. The tube that's placed down your throat when you're intubated does damage the vocal cords a bit. So they have to recover. When I was first extubated, I couldn't talk at all. I had to write everything on a pad. So that took a while to get my voice back. But it's recovering. And then I do have some other residual effects. My lungs are still not really how they were before. And I get winded easily. I'll walk up a flight of stairs or something and I'll be sort of panting a little bit, but that's getting a lot better. I can now walk a little distance and be fine. But right afterwards, it was really hard.
Now, do you have a physician who's seeing you through this? Are there now COVID-19 recovery specialists? What kind of doctor is that?
So it is a little bit difficult right now because in some ways the hospitals are still dealing with very active COVID cases. So I have been consulting telephonically with a pulmonologist at NYU Langone, and he would like to bring me in for x-rays and CAT scans and the so-called 6-minute walking test where you're on a treadmill and you walk for 6 minutes and they see how you do. But he can't do that yet because the staff and the space that are normally his and for that purpose are still being used for COVID patients. So it will take a while, I think, before I can be brought back in. Luckily, I don't have any urgent issues, but it is really the case that COVID has taken over many hospitals, certainly in New York.
Were they able to get a scan of your lungs before you left?
Yes, I mean they did X-rays, and by the time I left, the X-rays were looking a lot better. I had something that might have been bronchitis. They gave me some antibiotics for it. It's not uncommon to get a so-called follow-on infection from while you're in the hospital, but it was a different kind of cough. It wasn't the dry COVID cough. It was like a bronchitis cough.
And do you or have you experienced any of those like post-COVID reported symptoms like malaise or depression or fogginess of memory? Is that something you?
No, I've been very lucky. I feel very clear-headed. I feel very active. I have good energy. I gained back the weight I lost in the hospital. I sleep well. I lost about 15, 20 pounds. I think 17 maybe. And I've actually gained it back and then some. But anyway, it's been good. I've been on the road to recovery for a couple weeks now.
And the post-COVID world involves blood donations, plasma donation, antibody tests. Let's start with the antibody test. Have you taken that?
No, although I am actually working on that because I'm actually out here in New Jersey now, my parents' place, which is where I'm recovering, and my husband and our son, we go back and forth between my parents and his parents, my husband's parents. They're all out here in suburban New Jersey. We just have a little more space here, and it's just easier also because the grandparents help with our son when we're both trying to work during the day. But anyway, there's a local hospital here that's doing plasma donation, and we've been playing phone tag, but I'm supposed to go in, get the antibody test, And then if I have the antibodies, which I really should hope I do, then
After all that, you better.
Yeah, exactly. And then after that, donate plasma.
Yeah. And, it's so interesting because you made a reference to the antibodies test and how, we really don't know which tests are good, which ones show, false positives or false negatives. Has your husband, if I may ask, has he had an antibody test?
No, he hasn't. In fact, he's actually never even had a regular COVID test. I mean, I think he's presumptively someone who had it because he had the symptoms around the same time, very similar without the breathing problems. But he's never actually been tested. So I think there are a lot of people out there who aren't in these official counts who actually had it.
Yeah, yeah. I'll tell you that my husband has tested positive for antibodies.
Oh, wow.
But I have not.
Huh. And wait, did you have symptoms, either of you?
I had a very, what I think was a very bad flu, but before it so reportedly hit New York in mid to early February. Like what I considered 103 temperature, but it was very rapid and massive chills and exhaustion, fatigue. But so I went to my local clinic and urgent care on 14th Street, and basically was not given a flu test because they had run out, and COVID wasn't even in the mix. So they gave me Tamiflu, which I took, and which I attributed to my rapid recovery. So it could have been I think that might have been the flu, but I don't know how my husband got it. He had no symptoms, no idea, and he's had 3 tests. Two different types of tests. One a serological and one a rapid test. Now we dismiss the rapid test as being, those don't seem to be that dependable. But the fact that he had a serological test that showed he had the antibodies, it's so.
And you were negative on both of those?
I was negative on both, and I've since taken another one. I've taken another serological test going back to my urgent care center, because now you can get them with insurance easily. And I'm just doing it for a third time just to see, am I really negative with my husband being positive? I don't know. I think it might say something about our relationship, but not that
Was he or you, was one of you like traveling for a couple weeks or something? I mean, that's
not
weird.
Really. I mean, we can't really put our fingers on it. There was some period where he went down to Florida, but the other thing that's strange is that our 2 children, we got rapid tests for them too, just to see more of an.
Oh, and what did they test?
The 9-year-old tested positive on the rapid tests. The 2-year-old tested negative and then positive. Excuse me, positive and then negative.
Huh. Wow.
I think it goes to show you that the tests are really unreliable unless it's a serological test. And that's one. I mean, New York's rapid test that shows something like 21% of New Yorkers having had the virus has about a 20% false positive rate, according to the FDA website. So, that's a lot of leeway, in terms of what percentages we're looking at. Well, I'll be interested to know. And, one of the issues I've been working on has been the FDA, blood and plasma ban. And I know that's going to be a question you're going to be asked. But hopefully they've updated the guidelines in New Jersey where you're planning on donating.
I think it's now 3 months rather than a year.
Yes.
But yeah, that is. But I think some places still go by the year. So it kind of depends. Yeah.
How does that make you feel though, as a gay man, that you're going to have to answer that question and possibly, in theory, be turned away, like I was at the New York City Blood Center, particularly someone who's had COVID and wants to help treatment or find a vaccine?
No, I mean, it makes me angry. I think it's outrageous, especially since they test the blood or the plasma that's going to be donated anyway. My understanding is it's a holdover from the era of AIDS, HIV, but they can test for that now too. So I don't really understand. I mean, look, I'm not a doctor, I'm not a public health expert, but from what I've read, it doesn't really seem to have much legitimacy as a policy.
Yeah, no, that's absolutely correct. And the fact that they, during this blood crisis, which has, there's a blood shortage because of COVID, because of thousands of, blood donation fairs having been canceled, they shortened it from, as you say, 1 year to 3 months. I think really exposes the policy for what it is, rooted in this 1980s era homophobia. Well, I hope you're able to donate now. But now that you're back up working, ready to donate plasma and blood with your family, what's it like sifting through the bills? And
Huh.
are you getting a stack of them? Are these things being written off? What's your insurance coverage telling you?
So it's interesting. I do get these bills, and for people who've been hospitalized for a long time, will know that they sort of come in dribs and drabs. But I have added them up, and there's sort of that nominal cost, which is sort of the number that the hospital has, and then there's the cost that your health insurer actually pays, and then there's the cost out of pocket to you that you pay as the patient, the copay. So for me, the total sort of sticker price assigned by the hospital to the care I received is about, right now, I haven't gotten all the bills, I think, but I think I've gotten most of them, is around $320,000. What my health insurer, United Healthcare, has paid to NYU Langone is around $165,000. In terms of what was supposed to come out of pocket for me, I was expecting to hit my in-network out-of-pocket maximum, which is $6,000. But I discovered, to my pleasant surprise, that essentially health insurers, a lot of the major health insurers, are waiving so-called patient cost sharing, or the patient contribution, on COVID-19 treatment. Initially, when I had heard in the news, oh, their testing is free, I said, okay, that's great, but it's actually the treatment. So I hopefully shouldn't have to pay the $6,000. So far on the explanation of benefits, I've seen a lot of you pay or you may owe 000. I have one issue involving a bill for an earlier emergency room visit where I had COVID-19, but I hadn't yet tested positive. It wasn't coded as COVID-19. So I've asked NYU to review it because United Healthcare needs the right code on it in order to do that. So that's like the one little hiccup. But otherwise, I feel really, really lucky.
Wow.
And I think it's just to comment on how, if you don't have health insurance in this country, you could just be devastated, because otherwise you would have to pay this six-figure sum. And I don't know the extent to which you can negotiate with a hospital, but it can be really financially devastating if you don't have insurance.
Well, this is going to be, I guess, part of the COVID, cleanup when we hopefully soon leave the depths of the pandemic, helping vulnerable people sift through this. I mean, but so as it stands for you, somebody with insurance and somebody who's a lawyer, are you on the phone much with either the hospital or the insurance company, other than this one blip of an expense?
No, I've just been able to communicate with them online, and both UHC and NYU Langone understood my issue very clearly. So hopefully it'll be resolved, but it hasn't really been that aggravating. It's not like these nightmare scenarios where on hold for 8 hours or something. It's been pretty easy so far.
Do you think about using your skills as a lawyer to help COVID survivors? I'm wondering if we as attorneys should, form a COVID legal corps to help. Like, there are going to be so many issues that, whether it's unemployment, residential, commercial leases, insurance coverage, it's going to require a lot of paperwork probably to extract yourself from this condition.
Yeah, no, I think that's a great idea. I mean, I'm a little rusty in terms of practice since I've been a journalist for most of the past, X years. But I would be happy to help out. I think it's a really important issue, and I think there's a definite need for help.
Yeah. We're getting a question here from Jane on Facebook. asking, did David befriend any other survivors? And do you know, are there survivor groups forming?
Yes, mostly online, actually. It's hard to obviously get together in person given the state of things, but there's one called Survivor Corps on Facebook, which is great, where people post stories and questions, and we get to communicate with each other. I've connected with a whole bunch on
Survivor
Twitter.
Corps.
Survivor Corps, yeah, CORPS.
And that's a Facebook group?
Yes.
How many members?
Oh my gosh, I think it has thousands by now. It may even have more than 100,000. It's really quite large. And I believe the founder is actually a New Yorker too. But it's a very large group. And I've also connected with other survivors on Twitter, for instance. It's been interesting to sort of compare notes as we're recovering. On Twitter, I do a weekly update in terms of the status of my recovery, where I kind of report on various metrics and how I'm doing and things I can do this week that I wasn't able to do the week before, just to kind of contribute to our knowledge of this and what the recovery is like.
Do you think that there are going to be, psychological issues for some who survive? Is there any element of, pardon me for being an armchair psychiatrist, but survivor's guilt? I mean, given the devastation that this illness has caused?
Oh, absolutely. I mean, I certainly have that to some degree. You just feel so lucky. I've heard a lot of stories. People reach out to me because I've been talking about it so openly on social media, and will tell me stories of having lost a father, a cousin, a sibling. So it is really, there's definitely that sense of just, well, why did I survive and other people didn't? And it's just, there's just, I don't know, it's just luck or fate or whatever you want to call it. One thing I do feel somewhat better about, though, is I'm glad that what many feared in terms of widespread shortages of ventilators, it doesn't seem to have come to pass. I mean, knock on wood, because that was something I was definitely thinking of in terms of survivor's guilt, in terms of, well, if there was a ventilator shortage and I was given one of them and I survived and someone else wasn't and they died, that's something that would keep you up at night.
Mm-hmm. What would you have thought if you'd been sent to the Samaritan's Purse encampment on Central Park?
Oh, yeah. I'll just say I really liked NYU. I thought they did a great job. It's a lovely facility.
Very, very politic answer. We're getting a question here from Brian. He's asking you, what kind of contact did the state of New York or city health department have with you? Have they since followed up?
That's interesting. I actually have not heard from any governmental authority. I assume that the hospital, yes, exactly. I assume that the hospital has been in touch with them. I am curious about it because my husband did call his primary care physician just to give him a heads up that, look, I probably had this. I don't know what your reporting obligations are, but FYI. So I'm not really quite sure how that works, but I've not heard from any representative from the Department of Health.
That's so interesting. So it's been reported, and the data is really thin or non-existent in terms of what kind of people are contracting COVID and what their outcomes are. Particularly, I mean, we've heard that it's obviously an enormous impact on communities of color. We don't have any data or information on outcomes for LGBTQ people. I've seen nothing about, I don't know, maybe you have, on people with HIV and what their outcomes look like. I've seen virtually nothing on it.
No.
Have you?
I have not. I've seen analysis of other comorbidities, high blood pressure, obesity. I should mention, I did have, as a child, asthma, and as an adult, exercise-induced asthma, which I was able to manage with an inhaler. But I think that may have made me more susceptible to a bad case of COVID-19. So asthma is on the list, although it's not as high as a lot of people thought. It's actually not in the top 10 conditions. There's been interesting research on the conditions that have been major contributors, but I've not seen anything on HIV, although I would think it could play a role just given what it does to the immune system.
I mean, one of the earlier warnings was about people who are immunocompromised. Of course, most people with HIV now with antiretroviral drugs have pretty strong CD4 counts. There's also a theory circulating. Again, I haven't seen any confirmation of it, and I'm sure it's going to be studied for a long time. Do any current antiretroviral drugs that folks with HIV are taking provide any protection to individuals from COVID-19? It's a fascinating question. I haven't, again, I've just heard the theory kind of knocked about, and there is an age drug that is an experimental, I guess, with compassionate use approval for people with COVID-19.
Yep.
We have another question here from Avi. He says, I'm sure your husband and son did everything they could to help you once you finally got home. What should those of us who might have family members with COVID-19 do now? What are the essential supplies? What are the essential skills and tasks that they
So it's interesting. I actually tweeted out a post that was originally posted by a woman named Carrie Severino, whose mother, who I believe is a nurse, helped her father, who had a case of it, and managed it at home. And it was a really, really good post of just how to care for someone who has COVID-19. I can offer a couple of very preliminary thoughts. I think one thing that's very important to have is a pulse oximeter. It's this little device. You can stick it to your finger, and it can basically tell you your oxygen level. And if your oxygen goes too low, you should go to the hospital. A lot of times, one weird thing about this disease is people can have very low oxygen levels on COVID-19 and still be functional, still not have a subjective feeling of shortness of breath. And so they think they're fine, but they're not, because their oxygen levels are really low. And by the time they actually get to the hospital, they may have suffered some organ damage or other bad outcomes because they didn't go earlier. So definitely have a pulse oximeter, try to monitor your loved one's oxygen level. I think that there have been some good op-eds about this. Dr. Richard Levitan, who's really a leader in this field, wrote actually 2 pieces for the New York Times about it, just about the importance of measuring your oxygen level. I think that really is sort of one big takeaway, but you have to be careful because it's very contagious. I believe that, for example, when Chris Cuomo, the governor's brother, had it, he was trying to basically stay quarantined in their basement, but I believe his wife got it too. So it's a very, very contagious disease, and you can take your best efforts, but it can be tough to not get it.
Yeah, it seems that way. And do you think that your 2-year-old was exposed? He was obviously exposed.
Yeah, we're pretty sure that if he were to be tested like your kids were, I suspect he would be positive because we both had it. You know, we spent so much time with him. I think he had it.
Well, I mean, one of the unknowns that's so alarming is now the Kawasaki-like condition that young children have been afflicted with.
Yes, it's really frightening. And so obviously we're watching him just to make sure he doesn't have any symptoms that seem consistent.
And frankly, again, you having it as early as you didn't have that concern when you went into the hospital.
Nope.
That would have been just another thing to be certainly worried about. One of our viewers, Helen, is asking, you had an interesting thread on Twitter where you pointed out how plumbers are essential to keeping oxygen tanks clean and safe. Who were some of the other unsung heroes of your coronavirus experience?
Well, so certainly I think we pay a lot of attention to doctors and nurses, and as well we should. They're amazing. And I had incredible doctors and nurses who really saved my life when I was at NYU Langone. I guess I would point out 2 other things. One, all other healthcare professionals, because there are a lot. It's not just doctors and nurses. For example, when I was sick, I had a speech pathologist come in to look at my swallowing, to talk to me about speaking, to make sure my vocal cords were okay. There are all kinds of, another really good unsung heroes, respiratory therapists. See, these are the folks who make sure that your ventilator is running properly and who make sure that your respiration is okay. I had no idea what a respiratory therapist was before I went into the hospital, but their work is crucial. These ventilators don't operate themselves. You need experienced personnel. And then the last thing I would say is also the people who clean the hospitals, the cleaning staff. I mean, we like I said, we think of the doctors and the nurses as well. We should, but there are a lot of other people who are putting themselves and their families in the line of fire here, and it's obviously really, really important to keep the hospitals clean and sanitary.
Yeah, yeah, absolutely. What are your thoughts about science and public policy now that, it matters more than ever? You see the president at his briefings. You see Governor Cuomo at his briefings. Are you watching those as a COVID survivor? Is it something you're following closely, or you're too busy?
I can't. I'll just say I can't watch the president's briefings. I just can't.
Yeah.
I'll read the news. I'm a good citizen. I read the news coverage afterwards. I just can't watch them in real time. It's just, I just can't.
And your thoughts on the issue of vaccines and how this issue is spotlighting that difference among a significant number of Americans, it seems, who still refuse to believe that vaccines do more good than harm for the vast majority of people who take them.
No, it's really upsetting. I think we need to pay attention to scientific and medical expertise more than ever. And there are all kinds of crazy theories that are floating out there that I think could do real harm and could lead to loss of life. I think it's really upsetting.
And what do you make of protesters, the lockdown protesters, who say they have a right to ignore public health advice?
I mean, obviously, I also find that upsetting. And look, I'll be honest, even though I almost died from this, I can understand where they're coming from. Like, we don't like being cooped up all the time, and we miss, New York is an amazing city. I used to go to the theater. I used to go to the movies. I used to go to the gym. I used to go to Madison Square Park. I miss all of that. So I totally get where they're coming from. And I also understand the economic effect it has on people. I mean, there are a lot of businesses that unfortunately probably are never going to come back. So I understand that there's a really heavy interest on the other side. I don't just cavalierly dismiss them. But I think we really do need to listen to the experts here. Once the experts and the public health officials say it's safe to be back, I mean, I will definitely be out there. I mean, look, obviously, I don't, cautiously, of course, but I want to support local businesses when they reopen. But I think right now, at least in some areas, certainly New York. There may be other parts of the country where maybe their experts say it's okay, and I wouldn't impose New York rules on everyone if doctors and public health experts in other parts of the country say it's not necessary there. But I think in New York, we're not yet out of the woods.
Yeah, indeed. And you've got this kind of 360 view of the legal profession. What's it doing? What is the recession and the pandemic doing to law firms across the city?
So, like many professions or industries, there's been a huge job loss. I think the Bureau of Labor Statistics said that, I can't remember what the exact numbers or time periods were, but I think it was something like 60-something thousand jobs in the legal sector have been lost since the pandemic. And that includes not just lawyers, but also paralegals, assistants, automated legal technology, other support personnel. But there's been significant job loss. Lawyers are more fortunate than many, though, because they have the ability to work remotely, unlike a lot of essential workers who do have to put themselves in a dangerous situation. Lawyers can work remotely. And I think one good thing about this whole pandemic is law firms, which are sometimes a little old-fashioned, have now understand that you can work very efficiently remotely. And I hope that that's something that the law firms remember even after this is behind us.
Yes. And I wonder what the impact's going to be on commercial real estate. We already saw some law firms like kind of, you'd walk in a big law firm like Wachtell Lipton, and the space, is larger than the need for the number of attorneys now. I think that's going to be compounded, don't you?
Absolutely, especially if people start going back to work in shifts. Like, okay, some people on Monday, Wednesday, Friday, some people on Tuesday, Thursday. You don't necessarily need as much space, and it's a big overhead cost for law firms. And if they can find a way to reduce it, I think they will. So maybe it'll be more like a situation where on Monday, this is my desk, and on Tuesday, this is your desk, and we each have laptops, and we sort of a tech model. We'll sort of dock when it's our turn, but otherwise, yeah.
Wow. So I'm curious also to know, like the outreach that you've had, from your friends and family. I know you've had, I think even Cher tweeted at you.
Yeah.
That must have been a high point.
Yeah.
Were you conscious for that, or did you just go unconscious after you got the tweet?
I found out about a lot of this stuff well after the fact. Like Zach my husband would tell me, text me or tell me, Cher just tweeted at you, or Kathy Griffin, or Susan Rice, or like all these, or my old boss, Governor Christie, or it was really amazing. And it was bipartisan. I got a tweet of support from Ted Cruz. So, it was really all over the ideological spectrum.
Did you clerk with Ted Cruz?
No, he was a little bit ahead of me, but we knew each other a little bit from college debate circles.
Mm-hmm. And I just read the Topeka School, which I highly
yeah, mm-hmm. Yep.
For you debaters.
Yes,
exactly. But with all of my free time. But any Real Housewives tweet after you or not?
No, I don't believe so. But it really was amazing, though, to just have so much support. And I don't know that I would have made it through this ordeal without just so many family, friends, total strangers who were praying for me, thinking of me, rooting for me. I'm embarrassed. I still haven't returned all of the emails that I received, while I was, unconscious or in the hospital. But I really am trying to respond to everyone, because I am grateful to all of the people who contacted me. And so I'm trying to work my way through that, thousands of email backlog.
Do you feel like it's a second chance at life? I mean, are you that profound in your thinking?
Yeah, absolutely. That's kind of how I feel. That's what my mother told me. She's like, this is really like your second life, so make the best of it.
And are you going to do anything different at this? Are you planning on some embarkment in a different direction?
It's interesting. So far, I think I haven't really processed it yet. So I'm kind of sticking with what I've been doing professionally, personally. I have a demanding job. I have a 2-year-old, but there are definitely some things. Like I would like to write about this experience, perhaps, or maybe in conjunction with some other experiences in my life, because I think there is a lot of universality in some of what I went through, and it could resonate with readers. So, I wrote one book earlier, but it was a novel, and it was really set deeply in the legal world, whereas I'm trying to think about a writing project that would be a little broader.
It is interesting that this time of, isolation for us and, quarantine has, can give rise to a lot of writing, artistic endeavors and the like. I think that's one of the silver linings. It'll be interesting to see what art is created.
Yeah, absolutely. Totally. I mean, there have been a couple of silver linings. I mean, my husband and I, we spend more time with our son. We try to take a walk with him every day. My mother, who is a very good cook and baker, although she doesn't do it that often, like she's been baking more than ever. Like it just, there's more time with family. There's more time to just kind of think. Before I would look at my appointment book and it would be jam-packed, and now I look and there's this luxury of just all this blank space, and it's kind of nice in a way.
Yes, it is. Well, David, I just want to thank you so much. This has been such a interesting conversation. I hope my constituents found solace and inspiration in your story, as well as some frank and candid advice about how to deal with this condition if you have it or if a loved one has it. Any closing thoughts on how you proceed with a post-COVID-19 diagnosis and survivorship?
Yeah, no, I would just encourage folks to hang in there. I mean, this will be behind us at one point, not clear when, but I think we as a city have done a good job of helping one another. I'm really touched by the 7 p.m. Sort of shout outs for healthcare workers. So even though our present company excluded, even though sometimes there's some aspects of our government that might have let us down, I think people have really been there for one another during this, and I hope we can continue to be there for each other.
Thank you so much. I really enjoyed talking to you. Be well.
Thank you, Senator. It was a pleasure.
Good night.